Before we begin, please take a moment to review the disclaimer in the episode description. Remember, this podcast is for informational purposes only and is not a substitute for medical advice. Now let's get started. Welcome to Wound Basics, the podcast that does exactly what it says on the tin, helps people to understand wounds in very simple terms. I'm Dr. Frances Henshaw, Clinical Manager at Smith & Nephew, and my guest today is Anne-Marie Dunk. Anne-Marie is a clinical nurse consultant and heads up the Tissue Viability Unit at Canberra Hospital. She's also an adjunct associate professor at the University of Canberra. She's conducted lots of wound research, which has been presented and published nationally and internationally. Thanks for joining us, Anne-Marie.
Hi, Fran.
So today we're going to kick off by talking about skin assessment. So, Anne-Marie, skin assessment, apparently it's crucial for healthcare workers to undertake this. Can you explain its importance?
Absolutely. Skin assessment is one of my favourite topics. We actually know that skin assessment is one of the most important things you can do for the people that you care for and look after. A regular and comprehensive assessment of a person's skin is really important because it provides relevant information about the person's age, their state of physical and emotional well-being. You can also identify their cultural or lifestyle pursuits, and it identifies changes and alterations that you might pick up that may be of a primary concern or a secondary concern, and there's something that we might discuss as lesions or something abnormal at the skin surface.
So what you're saying really is that the skin actually is kind of a window for the rest of what might be going on with somebody.
Absolutely, Fran. I think that it's very underestimated that you actually can gather a lot of really good understanding about the persons that you care for by just really keeping an eye on their skin, and including of the skin is also their nails and their hair. It's one of the greatest organs of the body, and we just underestimate that.
Yeah, it certainly can tell us a lot. So we've established that it's very important to look at people's skin. So now let's delve into the actual process. What are the key steps that healthcare workers should follow when assessing somebody's skin?
There are some really good key steps, and we need to sort of start from the basis of identifying their privacy when you're looking at their skin, and also that their environment is nice and warm. We're wanting to look at their skin from top to bottom, from head to toe, that including their toes. People often forget that. And we want to look at the front, the back of the person, and also on the sides, the lateral sides. When you're turning a patient, it's great to be able to see that. Another opportunity is when you're taking the person out for a shower or doing any sort of cares, you might have that opportunity to have a really good peek at their skin and explore even areas between their toes and their nails and their fingers.
This episode of Wound Basics is brought to you by Smith & Nephew, shaping what's possible in wound care.
So some of the key steps that we would look at is looking at the skin colour. What sort of colour variation have you got at that skin? The temperature of the skin, and that can be just felt by touching. Whether you have some erythema, which is blanchable or not, that's redness. Erythema is another word for redness. There is some edema or tightness in the skin surface. Moisture is another really important thing to understand because it actually can cause a lot of damage to the skin. Whether you have some lesions, bumps, lumps that shouldn't be there. Whether the skin is rashed, there's rashes presenting. There's dryness. Too much dryness is as bad as too much moisture at skin surface. The patient will always identify if they actually have some pain. Some people do have pain and other people don't have pain. When you see a break in the skin, that indicates the presence of a wound, and for you to understand what that wound could be or put a label to it by identifying its etiology is really important.
So really, when caring for people in settings such as hospitals and aged care facilities, there are quite a lot of opportunities to assess people's skin, and it sounds like it's a real missed opportunity if we don't do this. So presumably we get consent from the patient and make sure all this is documented properly. And What are the common findings that people often see when they start looking for things?
Well, in the environment that you're talking about, there are many types of wound challenges that present, and we will probably touch on those in a little minute or two, but they're often things like skin tears, moisture-associated skin damage from excessive moisture types, and people that age often have issues around mobility and their inability to reposition themselves or have to lie in bed for long periods of time that may lead to people developing pressure injuries.
Yeah. So I think, this sounds like something that in these people that are actually vulnerable to skin damage, it really is very important to find out what's going on with the skin, because we can head things off at the pass before that they get to become something worse.
That's right, Fran. Prevention is part of wound care, and the more we do in the preventative space, the less we'll actually see some of these wound types.
Absolutely. And I think what you've said here really shows that taking a little bit of time, I know that healthcare workers are very busy, but it's time well spent, I think, if we can actually pick these things up early. So before we wrap up, do you have any final tips or recommendations for healthcare workers about how they can undertake their skin assessments?
I think start to think about, your IBS and your observation is one of the most important things you can do, and integrate your skin assessment as a daily practice. It doesn't matter if it's done in the morning or done in the afternoon, but when you have an opportunity to do any cares for a person you're caring for, take that opportunity to look at the skin.
What great advice, Anne-Marie. And I have to say, I think that this is such a simple thing that can be added into somebody's day without taking up too much extra time, because it can be done at the same time as other care procedures. So I think we've really uncovered a nugget of something here that will help a lot of people to prevent a lot of wounds and other skin conditions from becoming worse. So Anne-Marie, thank you very much for demonstrating to us the importance of skin assessments. I don't think you're going to get arguments from anybody that it's not time well spent.
Thank you, Fran.
Thanks for listening to Wound Basics. This show was brought to you by Smith & Nephew, shaping what's possible in wound care.